Hey everyone, it's Dr. G here, and you're listening to Discussions with Dr. G, where we break down, rant about, and occasionally laugh at the quirks of nursing pharmacology. So today we're talking about something that I honestly wish had been drilled into me as a new nurse: empowering our clients through tailored education and making medication safety a reality, not just a slogan on the break room posters. Now, before you start mentally checking out because assessment sounds about as exciting as watching saline drip, let me just say this. Assessment is everything. Seriously, if you don't know what your client actually understands, what they believe, or even what language they prefer, all of your fancy PowerPoints and med cards might as well be written in Klingon. So let's start with that knowledge base. Have you ever had a client act super confident and then it turns out that they think amoxicillin is for headaches? I'm not making that up. Assessing where folks are starting from matters. What do they already know? What's totally new? And what honestly might they believe that could get them into trouble, like internet vitamin cures or that one cousin's herbal detox tea? But we also got to check our own assumptions, right? A lot of us were taught that everyone learns the same, but that's wrong. Some clients want visual pamphlets. Some want you to explain it like they're 5. Others, believe it or not, learn best by trying it hands-on first. Hearing loss, low health literacy, cultural beliefs about medicine, oh boy, the power of a stubborn family member in the room. All of that matters. And don't forget the classic barrier, motivation, or sometimes the lack of it. I remember this one client, probably my favorite story. He just stared at me, totally disengaged, while I'm explaining his brand new meds post-discharge. Finally, he lifted his hand, pointed at the hospital room TV blaring daytime court TV shows, and said, "Honestly, nurse, the biggest barrier to learning in here is that terrible hospital television." He wasn't wrong. Sometimes the true obstacle isn't a language barrier. Sometimes it's Judge Judy. Anyway, the big picture. You gotta meet people where they are. Age, socioeconomic stuff, English proficiency, even who actually supports them at home. These all matter. And if I can give you one tip, act as if everyone is at risk for misunderstanding, no matter how confident they sound. Oh, where was I going with this? Oh, right. Let's move on to how we actually teach in a way that sticks. So once you've sized up your client's readiness, it's time to actually teach. But not just any teaching. Let's talk about using plain language. I mean, save your 5-syllable pharma terms for trivia night. Most folks don't want to hear acetaminophen hydrochloride administered Q8PO. They want to know, take these pain pills by mouth every 8 hours. See? Massive difference there. Visual aids are honestly your best friend. Bring out a colored pill card, the giant mock-up syringe, whatever you have, and do it in bites. Small pieces. No one remembers all 16 things you just rattled off. Ideally, keep it to 5 key points or less per session, and space them out if you have to. I know, easier said than done on a med-surg floor at 7 p.m. Now, here's where the rights of medication come in. Those classic right client, right drug, right dose, right time, right route rules. But flip it. Use these as teaching pillars. Walk with your client. Like, show them how to check the label for their name. Explain how generic and brand names can look different and why insurance loves to make it confusing. Clarify what Q8 actually means. Trust me, a lot of people think 3 times daily is the same as every 8 hours. Big spoiler, it's not. I had this client once, dexterity issues. Could barely hold a pen, let alone use an inhaler. He looked at the fancy device like it was a spaceship. So I tapped into my hobby, acrylic painting, and I said, "See, using the inhaler is like handling a paintbrush. Gentle, but precise." We practiced together, same steady wrist, pay attention to the angle, and you know what? Eventually he could use it without a hitch. Point is, take something familiar and make it work for the client. And don't forget the family. If they're around and supportive, teach them too. The more layers of understanding, the safer everyone is. All right, so you've done the teaching. Now, how do you actually know if they got it? Like, for real. Let's talk about evaluating, learning, and keeping people on track. Here's the part where things get real. I used to think if someone nodded along, I was good. Wrong. You have to actually check. Open-ended, not those yes, no, did you get it traps. Enter the teach back method. You make them show you, literally. Like, show me how you draw up insulin, or describe in your own words how you'll take this medication at home. If they get it wrong, you tweak how you teach. Don't just repeat yourself louder. I promise, yelling as an instructor or yelling in any instructions never gets anyone any smarter. Teach back isn't just a checkbox. It doubles retention, drops readmission rates, and saves everybody, including you, a lot of grief. But here's the thing. Be ready for creative interpretations. My classic pet peeve is when a client says, I know, and then a week later I hear they used a suppository as a cough drop. No, I am not making that up. So keep the evaluation open, gentle, and honestly, a little funny if you can. Personalized adherence is where it all comes from. Figure out their daily routine. Do they always have coffee in the morning? Pair meds to that. Is their TV time their thing? Put the pill box by the remote. Simplify regimens where possible. Extended release, combo pills, whatever works. And don't be shy about technology. Using phone alarms, pill organizers, even smart bottles that tattle on you by texting to your phone. There are so many tools. The trick is matching them to the client's reality. Include family when it makes sense, and always make space for them to admit what's not working. All right, that's my therapy podcast for today. If you take nothing else, remember, assess, personalize, and evaluate. And never trust a nod for comprehension. We'll tackle even more of the wild world of pharmacology next time, so keep your med guide and maybe some humor close by. I'll catch you then.